May adlaw na tong tanan. This is what I did to control my severe back pain. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. If you have a back pain, it is very difficult to bend or move around. The most common type of back pain is low back pain, and sometimes you might even have a shooting pain from your butt going towards your foot. In that case, then you might have sciatica. But don't you worry, in this video I'm going to show you what I did to control my severe back pain. Before we get started, rate your pain level from 0 to 10, with 10 being very painful, where you cannot tolerate the pain. Alright, so the exercises we are going to do, you can do on your bed. I am just going to use a yoga mat. That way you can see the movements easier, okay? The first exercise is deep breathing. Alright, so we're going to lay on our mat, or in your case, your bed, and put your hands on top or close to your pelvis and breathe in first, inhale, and then when you exhale, push your hands down and towards your pelvis. You will feel a sore spot there, okay? So try to move your hand around after you exhale and try to push in that sore spot. That is your iliopsoas muscle that you are palpating there, okay? Push until you feel that that muscle has released or has relaxed, okay? So again, inhale and then push towards that muscle when you exhale. Let's move to the other side. Inhale, exhale, and try to find that sore spot and push. Push until that muscle is relaxed, okay? Sometimes your legs will begin to shake or tremble, but that is just because of the pain. So just keep on breathing, and when you exhale, push even more. All right? And that is your deep breathing with deep palpation. The next exercise is pelvic bridging. So again, we are going to lay on our bed or our mat. Bring both feet as close to your butt as possible and support yourself. Bring your hands to the side of your body, and you're going to raise your hip up or your butt upwards like this and squeeze your butt muscles or your glutes when you go up. Bring it back down and then bring your hips up while squeezing your butt muscles. Alright? So we're going to do 10 of these bridging exercises. Alright? Let's start. 1. Don't forget to squeeze your butt muscles, okay? 2. 3. 4. 5. 6. 7. 8. 9. 10. And that is your bridging. The next exercise is your back and your hamstring stretch. So you just do a long sitting. You can keep your other leg bent like this or to the side like that, okay? Like this, all right? So all you need is a belt, okay? So you're just long sitting on your bed or on your mat. Place the belt on your foot and pull yourself down slowly, okay? And try to hold this for 10 seconds, all right? So let's start with our left leg and pull yourself down. If this is all that you can do, then just stay there. Do not force yourself, all right? Just give it a gentle pull towards your foot and hold it for 10 seconds. All right, let's start. All right, now let's do the other leg. Let's do the left leg. Place that belt around the sole of your foot and pull yourself down. Okay, again, let's do 10 seconds. And that is your back and hamstring stretch. Next exercise is the figure 4 stretch. So we're just going to lay on our backs, bend both knees, then cross one leg to the other. Okay? So if you cannot do that, just bring your legs down a little bit more, then bring the other leg up and just slide the other leg, the other foot towards your butt like this. Okay? If this is all that you can tolerate, just try to push that leg that is close to the other leg down like that. Okay? But if you can do this, grab the back of the knee of the other leg and pull it towards you. You should feel the stretch right here and just hold it for around 10 seconds. Okay? So let's start. 10 seconds. Bring it slowly down. Assist your leg down. Do the other leg. Cross your right leg over your left leg. Again, if you cannot tolerate the figure 4 and the hugging, just slide your left foot up towards your butt and hold it there. Push on that right leg. Okay? Now we are just going to grab your left thigh, just the back of your knee, and bring it towards you. This will gently stretch your lower back and even your glutes. And slowly bring it down. So that is your figure 4 stretch. The last stretch we are going to do is the segmental back stretch. So we are going to stretch our back segment by segment, starting from our neck, the upper back, the middle back, and then the lower back. Okay? So the first segment is the neck. So you're going to just bend your neck, bring your head down, relax your shoulder. Next will be your upper back, then your middle back. Imagine giving yourself a hump back or a hunchback, okay? And then your lower back. Slowly bring yourself down. Relax your head until your hands are almost touching the floor. If you can touch the floor, that is also good, okay? And then hold this position for about 15 to 30 seconds, right? After 15 to 30 seconds, slowly bring yourself up from the low back, the middle back, upper back. Relax your shoulders and then your neck. All right? And that is your segmental back stretch. All right, so those are my recommended stretches that I myself did to control or reduce my severe back pain. I did that every day. I stretch every day so I will be able to move and do my job being a therapist. All right, so just bonus tips. Avoid sitting for long periods of hours. Stand up more often, because sitting will only contract those hip flexors that is connected to your back, and that will cause the back pain. That is the most common cause of back pain. And when you sleep, another tip, when you sleep on your bed, this worked for me. I placed pillows under my legs like that. That way my hips are pointing backwards, which will give me a posterior pelvic tilt, which will help relax our back muscles. When we sleep sideways or when we sleep in other positions, our back is compromised, it is twisted, so that will also result to further back pain the next day. And when we sleep, we are in one position for a long period of time. So in order for us to manage our back pain, we need to sleep in a correct position with our spine straight. Okay? So now try to rate your pain level from 0 to 10. Check if it has improved. Check if you are able to move better. If you have any questions, comments, or suggestions, just type it down below. And if it helped you, consider sharing it to your family and friends, especially those who have chronic back pain or just had a back pain. But reminder, check your doctor first. See if there is a problem or if there is a fracture, especially after a fall. Make sure that there is no fractures, okay? So again, a reminder, consistency is the key and never give up. Until next time, paalam!